Hi viewers, this is J. Swami, Assistant Professor of Zoology. In this class, we are going to discuss another important endocrine gland, that is adrenal gland. The name itself indicating adrenal. Ad means upon, renal means kidney. The adrenal glands, they are present upon the kidney, above the kidney. These are also known as the suprarenal glands. Suprarenal glands. In the human beings, there are one pair of adrenal glands are present on the top of the kidneys. These adrenal glands, if you take into consideration the section of the adrenal gland, you can differentiate the tissue of the adrenal gland get differentiated into two regions. So outer there is a coverage of the capsule. Internally you can differentiate into outer cortex and inner medullary region. So this is the medulla and this is the cortical region. That is the tissue of the adrenal gland differentiate into two distinct regions, outer cortex and the inner medulla. Cortex and medulla, they produce and secrete different kinds of hormones. So cortical hormones are different and the medullary hormones are different. Let us see one by one. If we see the furthermore section of the adrenal gland, so as we know, outer cortex and the inner medulla. If we see the cortical region here, this is get differentiated into three regions: zona glomerulosa, zona fasciculata, and zona reticularis. These three regions are confined to adrenal cortex. From the zona glomerulosa, we will see the production of, this is the zona glomerulosa. We will see the production of the mineralocorticoids like the aldosterone. Whereas this region of the cortex is known as the zona fasciculata, where it produces glucocorticoids. The best example for the glucocorticoids is the cortisol. And this is the another region of the cortical region, zona reticularis. It can secrete glucocorticoids and small amounts of androgens, that is in the form of estrogens, otherwise the testosterone. So these all are the cortical regions and their representative hormones. This is the medullary region. Medullary region composed of chromaffin cells, where it produces adrenaline and noradrenaline. Otherwise, they are also named as adrenaline is also known as the epinephrine, and noradrenaline is also known as the norepinephrine. So both of them, they are commonly called as the catecholamines. There is a catechol ring, so that it is known as the catecholamines. So here, whenever you discuss about the cortical hormones, the hypothalamus that produces a particular hormone which is known as the corticotrophin releasing hormone. This corticotrophin releasing hormone that reaches adenohypophysis, otherwise anterior pituitary gland, through the hypothalamo-hypophyseal tract and reaches the anterior pituitary gland and stimulates the production of ACTH, adrenocorticotropic hormone. And this adrenocorticotropic hormone mixed up with the bloodstream and finally reaches only the cortical region, interacts with the cortical region of the adrenal gland. Here it stimulates all the three regions of the cortex, that is zona glomerulosa, zona fasciculata, and zona reticularis, and leads to the synthesis and release of, from the zona glomerulosa, that secretes the mineralocorticoids, and Zona fasciculata, that is releases glucocorticoids, and zona reticularis, some amount of little amount of glucocorticoids plus androgens. So this is the mechanism of action behind the release of the cortical hormones. Let us see one by one the cortical hormones. Here in the cortical hormones, this is the zona glomerulosa. Zona glomerulosa produces the mineralocorticoids. Mineralocorticoids. The best mineralocorticoids are the aldosterone and the corticosterone. These mineralocorticoids are named because of they affect the minerals like the sodium plus, potassium plus, H plus. Now, these aldosterone, corticosterone, these are chemically steroid hormones. These are chemically steroid hormones. Now, these steroid hormones, especially the aldosterone, increases the rate of sodium plus reabsorption by the kidney. The aldosterone increases the reabsorption rate of the sodium by the kidney and thereby increase the blood sodium levels. At the same time, it eliminates the potassium and the H plus ions. At the same time, when it increases the sodium plus reabsorption, at the same time, it eliminates the potassium and the hydrogen ions from the body fluids. Sodium reabsorption can result in increased water reabsorption by the kidneys, and thereby there is an increase in the blood volume of the organism. Some of the times what happens, the hypersecretion of aldosterone result in the abnormally low blood levels of sodium, potassium plus and the H plus. The reduction in H plus, can cause alkalosis. That is an abnormally elevated pH of the body fluids. The decrease in the potassium levels in the body affects nerve impulse transmission, leading to muscular paralysis or muscular paralysis. That is, whenever there is a H plus reduction, that leads to the alkalosis, and if there is a decrease in the potassium level, that leads to the muscular paralysis. This is about the zona glomerulosa and its representative hormones. And coming to the second one, zona fasciculata, where it secretes glucocorticoids. The best example for the glucocorticoids is the cortisol. Why they are named as the glucocorticoids? Because they affect the glucose metabolism. Cortisol and corticosterone, they affect the glucose metabolism, so that they are known as the glucocorticoids. The target tissues and the responses to the glucocorticoids are numerous. The two major types of responses to glucocorticoids are metabolic and the anti-inflammatory effects. Cortisol is the common glucocorticoid. It converts the amino acids and lipids to the carbohydrates. That is, conversion of non-carbohydrate material into the carbohydrates, that is amino acids and lipids into the carbohydrates, is known as the gluconeogenesis. That is cortisol that facilitates the gluconeogenesis, where it converts the amino acids and lipids into the form of carbohydrates, and thereby it raises up the blood glucose level. Then glucocorticoids aid in the utilization of carbohydrate, fat and proteins by the body. So the same thing will be happen in the activation of the cortisol and corticosteroid. That is, CRH releases from the hypothalamus and it interact with the adrenal and anterior pituitary gland, that is the ACTH, then that stimulates the production of the cortisol. Right? Cortisol acts on the target organs, resulting in increased fat and protein breakdown and increase the gluconeogenesis. Cortisol has a negative feedback effect because it inhibits the CRH release from the hypothalamus and ACTH secretion from the anterior pituitary as and when there is no necessary of the cortisol. And cortisol produces anti-allergic and anti-inflammatory responses in the body. For this reason, hydrocortisone is a commercially available preparation of the cortisol is used to reduce inflammation. Hydrocortisone is a commercially available preparation of the cortisol. It is highly extensively used in the reduction of the inflammation. Cortisol also stimulates RBC production. Hypersecretion of cortisol results in the abnormal disorder which is called as the Cushing syndrome. If there is a overproduction, otherwise a hypersecretion of the cortisol, that results in the onset of a particular disease which is known as the Cushing syndrome. Cushing syndrome is an abnormal condition caused by overproduction of the cortisol and other cortex hormones in general. Adrenal tumor also causes this disorder. It is more common in females than the males, and the symptoms are not only these ECG abnormalities, striae, edema, proximal muscle weakness, osteopenia or fracture, headache, backache, recurrent infections, abdominal pain, acne, and female balding. Not only that, here you can also see the fat deposition in the face, that is looking like the moon face, and fat deposition in neck and the back region, that is called as a buffalo hump, and purple striae on the skin we will see, weakness of the muscles and bone fractures, thinning of arms and legs, poor wound healing and low lymphocytes, increased salt and fluid retention with edema, increased androgen production and mild virilism, defects in the menstrual cycle in females, and there is every possibility to get the sexual dysfunction. These all are the signs and symptoms of the Cushing syndrome, overproduction of the cortisol, right? Then coming to the furthermore, so here there are certain symptoms: upper body obesity with thin arms and legs, buffalo hump, here you can visualize, then a red round face, moon face, high blood sugar, high blood pressure, vertigo, blurry vision, acne, female balding, then water retention, menstrual irregularities, thin skin and bruising, purple striae on the abdomen, here you are observing, then poor wound healing, then severe depression, so cognitive difficulties, emotional instability, sleep disorders and fatigue. These all are the different kinds of signs and symptoms of the Cushing's syndrome. So this is the baby with the Cushing syndrome. If the child affected with the Cushing syndrome, so these are the features. Then if you see furthermore, there is another region where you can see the zona reticularis. This zona reticularis, here you are observing zona reticularis in this region. This produces androgens. Zona reticularis secretes androgens which are named for their ability to stimulate the development of the secondary male and female sexual characteristics. Small amounts of androgens are secreted from the adrenal cortex in both males and females. In adult males, most androgens are secreted by the testes. In older women, Overproduction of the adrenal androgens causes the masculinizing effects such as the growth of mustaches and beards and change in voice. This condition is commonly called as a adrenal virilism. Adrenal virilism. Then, if you see furthermore, these are the hormones of the adrenal cortex: zona glomerulosa, mineralocorticoids, zona fasciculata, glucocorticoids, adrenal cortex, zona reticularis. Then they produce the androgens. So these are the characteristic features. Then we left only the adrenal medulla, where adrenal medulla, it is made up of chromaffin cells. These chromaffin cells, they produce catecholamines. Catecholamines commonly called as epinephrine, norepinephrine, or adrenaline, noradrenaline. What is the difference in between adrenaline and noradrenaline? That is, adrenaline contain, along with the catechol ring, it contains a CH3 group, methyl group. Then if there is no methyl group at all, that is non-adrenaline. So the adrenal medulla produces two amino hormones. Just now we discussed adrenaline or epinephrine, noradrenaline or norepinephrine. These two hormones are commonly called as the catecholamines. They are produced in response to emergency situations. Emergency situations. So that they are called as the emergency hormones, otherwise fight or flight hormones. Emergency hormones or fight or flight hormones. What is the difference in between adrenaline and noradrenaline? Adrenaline differ from the noradrenaline by having a additional methyl group in its molecules. The effects of adrenaline are more common and those of noradrenaline which are very limited. The main effects are reaction to danger and fight or flight response, increase in heart rate and cardiac output, vasoconstriction and vasodilation that closes or opens the capillary beds, shunting of blood to skeletal muscles and away from the digestion and reproduction, sudden release of glucose into blood and consequent rise in blood pressure, piloerection, that is rising of body hair in fear or anger. Piloerection is also the function of the catecholamines. These are the catecholamines are the medullary hormones. Catecholamines are the medullary hormones. These are the emergency hormones, otherwise fight or flight hormones. Fight or flight hormones. See, what is the Addisons disease? Addisons disease is a rare but serious glandular disorder where the adrenal glands don't produce enough cortisol and sometimes the aldosterone. Addisons disease usually results from the infection, for example by the tuberculosis like disease, or by the autoimmune destruction of adrenal gland. The disease was named after the discoverer of this disease, Thomas Addison, in 1855. In the year 1855, the discoverer of the disease was Thomas Addison. Thomas Addison in the year 1855. What are the symptoms that include under the disease? Hyperskin pigmentation, that is appearance of bronze scars in different regions. Then pigmentary lines in the gums, chronic fatigue, nausea, vomiting, loss of appetite, weight loss, lack of energy, recurring abdominal pain, and patients generally crave for salt and salt products due to excessive loss of the salt in urine. These are the symptoms of the Addison's disease. So here one in 1 lakh people, one get affected in 1 lakh people. The most affected age group is the 30 to 50 years old people, and women and men are equally affected. And diagnosis is done by the measuring of hormone levels in the blood and urine. And here you can see the specific combination: Addison's disease, comorbid conditions, infections, tuberculosis, rheumatoid arthritis, lupus, and dysfunctional liver. Here the symptoms are extreme fatigue, weight loss, and decreased appetite, low BP, salt craving, and the low blood sugar, body hair loss, nausea, and vomiting. These all are the symptoms of the disease. That is the Addison's disease. So that here there are cortical hormones are different and the medullary hormones are different. Cortical hormones are mineralocorticoids, glucocorticoids, and the androgens, whereas the medullary hormones are the catecholamines, otherwise fight or flight hormones, otherwise emergency hormones. This is all about the adrenal gland. Thank you one and all.